Hello, I'm Brendan Shea, Product Manager at Phillips Healthcare, and I'm here today to talk to you about our Connected Care data management strategy. Connected Care is about open data management solutions that streamline information flow to provide optimal patient care and operational efficiency. Now, this is exemplified in a number of ways through transmission products like transmitting 12 leads to the hospital ahead of the patient, and in retrospective software review programs like Event Review Pro. Today we're going to be talking about two new enhancements to this Connected Care strategy. The first is periodic clinical data transmission. Now, what people have come to trust and rely on from Phillips for a solid 12-lead transmission story is now growing and expanding to cover more than just STEMI patients. Now, the HeartStart MRX monitor defibrillator can also be used for transmitting periodic clinical data from the field to the hospital ahead of the patient for all sorts of critical care patients. That includes trauma, stroke, respiratory, pediatrics, and other cardiac care, critical care patients that may or may not involve 12-lead ECGs. The idea being that when you have a critical care patient, the medic in the field doesn't have time to document, doesn't have time to transmit, might have time to talk to the hospital ahead of time. So by activating periodic clinical data transmission, they're able to start sending information periodically. Vitals would go at every minute, 12 leads would transmit whenever you capture them, and should there be a trigger event like an alarm or a mark event, that would then cause the MRX to grab a set of vitals and transmit up to 3 waveforms to the hospital for viewing ahead of the patient. Now, hospitals like this because this gives them some advanced time to make space, to consult and summon specialists, and to pull patient histories. And the medics like it because it allows them to return their focus to the patient instead of worrying about documentation or transmission. The next thing we're going to talk about today is batch LAN data transfer. Now, what we heard from large-scale fire departments is that they're looking for a way to be able to move their data off of their devices and down to the fire station and downtown to headquarters where those cases can be reviewed. And they would like to do this as seamlessly and effortlessly as possible. So what Phillips has done is been able to utilize the LAN cable on the back of the MRX. Now, only the MRX, the HeartStart MRX, has a LAN port on it. And by doing so, the medic need only to plug in that LAN cable, select Send All, and all those files at once can be moved off the MRX to the local computer in the fire station. And then software running on that computer can forward those files downtown to where Event Review Pro is running. And Event Review Pro will automatically import those files. Now, this makes it very easy then for the quality administrator or the medical director to retrospectively go back and look at those files created from all of their devices in use around their operations. Building on the open data management philosophy, Phillips also has an SDK, a software developer kit, which is used by third-party EPCR vendors, electronic patient care reporting vendors. So in addition to the data management solutions that Phillips generates and delivers, we also have the ability to work with third parties where they can incorporate our data into their software solutions. So we're working with a number of vendors across the country and around the world to be able to integrate the data from the HeartStart MRX into their software. Some of these third-party EPCR vendors include ImageTrend, Sanzio, ESO Solutions, Medusa, and General Devices. So in summary, Connected Care is about open data management solutions that streamline information flow from the point of care to the point of need to enhance patient care and operational efficiency. For more information, log on to phillips.com. Thank you.